So I work at the Wythenshawe site of MFT, and our research hub is for burns, critical care and plastics. Wythenshawe is a big tertiary site. We take patients from all over the northwest of England and North Wales, and we're also very close to Manchester Airport, so we take patients from a very wide patch. From a critical care perspective, we have around 60 critical care beds split over 3 intensive care units. We have an adult general ICU with about 18 beds. We admit around 1,000 patients per year into our ICU. We have a cardiothoracic ICU that has around 40 beds. They have ECMO services as well as a lot of tertiary cardiac and thoracic services. And we have a burns ICU as well as part of our plastic surgery stream on site. We run a balanced critical care research portfolio built around our research interests, and these are principally the early detection of infection and then the tailored treatment of any infection that we find, typically tailoring therapy with antimicrobials. We also have an interest in acute and chronic respiratory failure and how you liberate patients from mechanical ventilation. Associated with that is an interest in airway management in the critically ill, and then optimising the high-risk surgical patient that needs to come to the critical care unit as part of their care. We run a mixture of our own studies, and we have a combined grant income of around £16 million in the last 4 years. We support the network portfolio studies with a dedicated team of research nurses and portfolio managers based on site here in collaboration with colleagues on other sites within the Trust. And we also run industry-sponsored and supported studies covering a variety of topics, but mainly focused around our interests around infection detection, antimicrobial management and airway management. We're fortunate to have a dedicated management team to help with our research setup, our research oversight, and we've recently been awarded a £4 million grant to develop some of our infrastructure for labs and diagnostic equipment to help with our research portfolio. We recruit to target, we recruit to studies on our site, we have strong collaborations within the rest of our network and throughout our region, and we also lead studies both nationally and internationally from our site here. By way of example, one of our national studies led locally has recruited over 1,000 staff and nearly 600 patients to help us explore strategies to improve tracheostomy care. And recruitment numbers like that have helped us to make the Northwest region amongst the highest recruiting regions per head of population in the country.